Welcome to For Your Health Media. This is Miriam, nurse practitioner. We're going to talk about high blood pressure, aka hypertension. What is high blood pressure? It's when the force of the circulating blood in your blood vessels is so high for a sustained period of time. Blood pressure, aka hypertension, is considered a silent killer. So a lot of times you might not have any symptoms. We have two types of blood pressure. Essential one, when the blood pressure just gets high due to some causes. Secondary is when you get it because you have other disease conditions. What are some of the risk factors? Age. The older you get, the higher your chances of getting blood pressure. Race. African descent. And Africans are the higher risk of getting blood pressure. Weight. When you are overweight. Inactivity, not doing much of any activity, a diet that is, not healthy, stress, chronic conditions, cigarette smoking. These are some of the risk factors that put us at risk for getting high blood pressure. And mind you, most of these diseases that have what is known as modifiable risk, because all the risks that I mentioned, really the one that is not modifiable, meaning the one that you cannot change, is the race and the age. But a lot of the other ones you can change it, your diet and all that. So then blood pressure is measured in two numbers. We have the top and bottom. Top is when the heart contracts, and then the bottom when the heart is resting. That's why you always see blood pressure, top number is high, bottom number is low. So what is the normal blood pressure? It's normally less than 120/80. Anything from 130 and up, we'll start saying you have a high blood pressure. So anything from 130 and up, it needs to be taken care of. When you go to the doctor and for whatever reason you have a high blood pressure of 180 over 100 or 120, we start thinking you are in a crisis. Something needs to be done. What are some of the complications of high blood pressure? You can end up with a heart attack, a stroke, an aneurysm. An aneurysm is when, because of the pressure, the vessel gets a bulge in it, and then if you get ruptured, we call it, you have a ruptured aneurysm. So it depends on where it happened. You might have some complications from that. Heart failure is one of the other complications from having high blood pressure. Your eyesight could be gone because of having a high blood pressure. So it's very important to take care of that. So what are some of the myths that we have about high blood pressure? What are some of the myths that we have about high blood pressure? Some people will say, I feel fine. Mind you, blood pressure is a silent killer. You might not have symptoms, you might not feel sick, but the pressure is rising and causing damage in the body. Some people say, I don't use a table salt shaker. I use kosher salt, or I use sea salt. Yeah. So some people will say, I don't use salt. I don't use a salt shaker. I just use kosher sea salt. Mind you, they still have about 40% of the sodium in them. Not only that, when you eat processed foods, some of this junk food and fried foods, they still have a high salt content. So just because you're not using a salt shaker does not mean that you are not consuming high doses of salt. So that's one of the myths. The other myths is people will say, some people tell me when I had high blood pressure, my face was flushed and this was happening and this. No. Mind you, that could be as a result of other conditions too. So it's not just because of high blood pressure. So make sure you are taking care of your health. So when you talk about taking care of your health, what do? There's not much you can do about the age or race, but you can watch your weight, exercise more, eat healthy. If you are smoking cigarette, stop cigarette smoking, manage your stress well, and then manage your chronic condition well. So the other thing also that you could do for your health is make sure you are doing getting blood pressure checked. That is why blood pressure is very important to the level to which they start checking blood pressure in 3-year-olds. When your child is 3 years old, they go to see the doctor, they start checking their blood pressure. So when you have high blood pressure, make sure you are watching your diet, salt intake, taking your medication, making your visits. A lot of times they also give you a machine to check your blood pressure at home so that you record it, bring it into your doctor so that you guys can discuss and see where your medication management, where your lifestyle will take you, and how to manage that blood pressure better. So that's it. Thank you so much. Remember, this is a silent killer. If you don't get measured, you will not know. And when you do have it, make sure you are checking yourself and taking good care of yourself. This is for your head media, where we give you bite-sized health information to take better care of yourself. So don't forget to subscribe, like, share, comment on the video. Thank you so much. Have a great day.